peer-to-peer exchange and best practices. Hi, I'm Mark Scrimshire. I'm Chief Interoperability Officer at Onyx Health, and I'm here to talk to you about peer-to-peer exchange, which is part of the CMS interoperability and patient access rule, and the best practices that you can adopt in order to really get the most advantage from peer-to-peer exchange. Peer-to-peer exchange builds on your payer's investment in the patient access API. It can reuse those existing FHIR APIs that you have implemented for the compliance with that rule. And it's a route to strategic advantage. Rather than just being a compliance activity, you can really bring strategic benefits to your organization. So let's look at 5 best practices to follow. The first one, really, what it all boils down to, build trust with your members. Be open about how their data will be used when you receive it. The second step is leverage the data that you retrieve. Under compliance, you basically have to be able to publish that data. You also have to be able to allow members to bring data in. But what's the use of doing that if it just sits there doing nothing? Look at how you can leverage it and put it to use. So how could you do that? That's the third best practice. Integrate that received data into your member management programs, whether it's care management, population health, whatever it is. Work out how to integrate that into those existing programs so that you can provide the extra data, the pointers that can help you identify areas where you can improve service, improve care, be more efficient. Fourth step, use the FHIR data to improve your financials. One of those areas is risk adjustment, and that's where what we call micro precision risk adjustment, because you can bring that guidance down to actions involving the individual member. And finally, use that FHIR data proactively to manage the health of particularly new members. When they join you, use their data to discover their medications that they need, the procedures they have, the conditions that they have. Don't wait for their conditions to deteriorate and they end up in the ER consuming expensive services, and then you put them onto prevention programs. Use the data as you receive it, as you enroll them, so that you can align them with the relevant preventative programs that are going to keep them fit and healthy and minimize your costs of care as a plan. There are so many more things that you can do. To find out more, please visit us at peer2peer.com. It's a service powered by Onyx Health, and we look forward to seeing you there.